All right, Oregon, you are actually getting this from my car, and there's a reason why. I needed to prove to you that I am in Oregon, and here's how I'm going to do it. Check this out. I am at the last remaining Blockbuster in the United States that is located in none other than Bend, Oregon. That is where I'm located. Rather than doing this video where I walk into a Blockbuster, I felt that I should probably stay in the car so that I don't bug a bunch of people. So here's how Medicare works in Oregon. And to understand how truly unique Oregon is, you need to understand how the rest of the country operates when it comes to trial rights. Now, trial rights refer to your opportunity to take an Advantage plan and try it out and have the ability to switch back to original Medicare and a supplement plan without a fear of underwriting or answering medical questions or having to pay more or potentially get denied coverage through a supplement plan. So there are two very important guidelines or barriers that they've set around these trial rights that you need to fall within in order to take advantage of it. So the first way to take advantage of a trial right is if you take a supplement plan first. So let's say you go on Medicare at any age, at 65 or 67 or whenever, and it's your first time on Medicare, and you choose a supplement plan first. And then later you want to try an Advantage plan. You can switch off of the supplement plan onto an Advantage plan, try it for a year, and then switch back to that same supplement plan without underwriting, without answering medical questions, without a fear of getting denied. You only get to do this once. You don't get to keep bouncing back and forth. It's only once. Again, you take a supplement plan first, you want to try an Advantage plan, you have that trial right. The second opportunity to take advantage of a trial right is if you take Medicare at 65 and you choose an Advantage plan at 65. Then you can try it out for a year, and if within that year you want to switch back to original Medicare and a supplement plan, you can do so without fear of medical underwriting. But this one gets tricky. This really only applies at age 65 and you're taking an Advantage plan first. And the reason for that is in order to take advantage of the trial right nationally, your Part A effective date, your Part B effective date, and your Advantage plan effective date, meaning the start date of all of those plans, has to be the same day. So let's think about that for a minute. Part A, if you take Part A after your 65th birthday, they do a look back that is either 6 months from when you apply for Part A or back to your 65th birthday month, whichever is closest. So if I take Medicare at 65 years old in 3 months and I sign up for Part A, they're going to backdate that to my 65th birthday month. If I sign up for Medicare at 67 years old exactly, they're going to backdate my Part A to 66 years and 6 months old. So the reason that that is important is because if I take Medicare at 65 years old in 3 months, my Part A effective date is going to be 65 years old to the month of my birthday, but my Part B effective date is going to be 65 years old in 3 months. There's a 3-month gap. And then my Advantage plan or any other plan's effective dates are also going to be 65 years old in 3 months. So it's not the same day. Part A, Part B, and your plan does not line up. Therefore, you cannot take advantage of the trial right. I think this is a silly rule. So for those who take Part A, maybe because they're working and it's no cost and they're going to keep staying on their group plan, and then they retire months or years later, and then they take Part B, and then they want an Advantage plan, they don't get the same trial right. Isn't that silly? Here is how I think it should be, and it is how it is done here in Oregon. If your Part A and your Part B effective dates are different, that doesn't matter. As long as you take an Advantage plan within 6 months of your Part B effective date, you have the same trial rights as you would have as the national rules that we talked about earlier, where you have a year to try it out, and then you can switch to a supplement plan without fear of underwriting or getting denied or higher costs. And this just makes sense. Again, you take Part A because it's no cost and you're still working, you retire at 67, you go on Medicare for your Part B, you get an Advantage plan first, and now you have a year to try that out. I think that this is how it should be nationally. They don't care what I think about all this, but that is how it works here in Oregon, which I think is fantastic. This whole conversation we've been having around trial rights relates to both Advantage plans and supplement plans, but it's a little bit more specifically to those who are considering Advantage plans. So let's stick with Advantage plans here in Oregon, and then we'll move over to supplement plans because there are some really weird, awesome rules when it comes to supplement plans as well. From an Advantage plan perspective, Oregon, at least on the western part of Oregon, you have Kaiser to deal with. So Kaiser is an integrated healthcare system, and the feedback that we get from Medicare beneficiaries who use Kaiser, it's very polarized. People either love Kaiser or they hate Kaiser. For whatever reason, we don't see a lot of people who are in between and kind of indifferent, very passionate on both sides. And the reason that people are passionate on both sides is actually the core of it is the same, and that is because it is an integrated healthcare system. There's a lot of coordination and communication between doctors, nurses, administrative facilities, the hospitals themselves, and the insurance plan or the Advantage plan. And so you can see this in the data. The number of prior authorizations that are denied on a Kaiser Advantage plan is lower, and my thought process around that is, well, the doctors and the administrative staff know what codes and what instructions that they need to send to the Advantage plan to get it approved, whereas other doctors or hospitals may not know the right codes for the insurance companies or the right justifications to be exactly correct, to where they get that prior authorization denied. Again, once it's appealed, the doctors can fix that, but it's just a little bit more to work around. Whereas Kaiser, it's all integrated. Now, the downside to that is they kind of have you handcuffed. You're stuck within the Kaiser system. So if you want to seek care outside of the Kaiser system, well, your Advantage plan isn't going to cover that. You've got to stay within Kaiser. If you don't appreciate or you don't like the care or the doctors or the facilities, but it's what you've been used to your whole life, well, that's where people really get turned off by Kaiser, because they don't appreciate that integrated system where you can't go out of it if you want to seek care outside of it. Now, Kaiser does not work with independent agents like myself or my partners. So if you do want a Kaiser plan, you need to go directly to Kaiser and an employee of Kaiser. You can't go to a broker of Medicare plans in order to get it. So if you love Kaiser and it's something that you really enjoy, go directly to them to look at their Advantage plan. If you don't like Kaiser or you despise Kaiser for whatever reason, then that's where I would look for an independent agent to look at other commercial plans available here. We will continue to run into Kaiser here along the West Coast and in other parts of the country, like Washington, we've covered it, Oregon, California, but just know that Kaiser is kind of an exception here in this state. Now, speaking of Advantage plans, the term is a market penetration. So how many people are choosing Advantage plans when given the option of Advantage, supplement plans, FEHB, VA, Tricare for Life, and others. And the market penetration rate nationally averages 50%. Here in Oregon, it's slightly higher at 54%. So you have a higher adoption of Advantage plans here in Oregon. And in your bigger cities or more urban settings, you have very strong Advantage plans here that are very good with a hospital networking coverage situation, which is why we see that little bump. The average maximum out of pocket nationally is around $5,000. And here in Oregon, it's pretty close to that, slightly above that. And again, that's going to change based on your zip code. And so there are plans that are higher, there are plans that are lower, but the average is just about $5,300 for Advantage plans here in Oregon. Now let's move to the supplement plan side of the conversation. So the average supplement plan G for a 65-year-old nationally is about $150 per person per month. Here in Oregon, it's about $160 per person per month, so slightly above the average. For Plan N, the national average is $120 per month. Here in Oregon, the average is about $130 per month, so slightly higher on supplement plans. But when you hear about the supplement plan rules that exist here in Oregon, it's amazing that these rates are as low as they are. And that's because here in Oregon, you enjoy a unique birthday rule. Now, there are other states that have birthday rules, but they are the minority. So this birthday rule is similar to other states that have it. But in terms of the 50 states, it is rare that states have this birthday rule around supplement plans, and this is the rule. Every year around your birthday, if you are on a supplement plan, you can switch to another supplement plan of equal or lower benefits with no medical underwriting. You will not have the fear of getting denied. Outside of states that have this birthday rule, if you were, say, on a Plan G and your rates have been going up and you wanted to switch off of that insurance company to another Plan G or even down to a Plan N, to do so, you would have to go through medical underwriting. And if you had bad health, you could be denied. Or if you had poor health, you could see higher than normal rates. Or if you had good health, you could get approved, but you would still have to go through that process. Here in Oregon, not the case. You can switch to a same plan, so a G to G, or you can switch down, so a G to an N, and you would not have medical underwriting around your birthday. You can't switch up, so if you're on a Plan N or a high deductible Plan G, you can't switch up to a Plan G, but you can go horizontally in terms of like-to-like plans. If you do want to switch, you have a 60-day window that begins 30 days before your birthday, and this version of the rule was started in 2023. However, there has been a birthday rule in effect here in Oregon since 2013, so very good for Medicare beneficiaries. And the last unique rule for Oregon from a Medicare supplement perspective is one of my favorite rules. I absolutely love this rule. Oregon, you're doing a great job protecting your Medicare beneficiaries. Let's talk about my friends who have Tricare for Life. Now, for most of the country, if you have Tricare for Life and you lose it, and you're eligible for Medicare, you do not have a guaranteed issue moment for your supplement plan, meaning that if you get divorced and you lose Tricare for life because of the divorce, you would have to go through medical underwriting to get on a Medicare supplement plan. Otherwise, you have to take original Medicare only or an Advantage plan. But here in Oregon, you do have a guaranteed issue right if you lose Tricare for life. And I absolutely love this rule. As a child of divorced parents, I know how ugly a divorce can get, and oftentimes a spouse now is losing their Tricare for life, and maybe it wasn't his or her fault for the divorce, yet they're having this significant reduction in healthcare benefits upon Medicare eligibility because of this weird Tricare for life and guaranteed issue supplement plan rule. So Oregon protects them and allows them to get on a supplement plan in the event they lose Tricare for life. The supplement plan penetration rate nationally is 21%. Here in Oregon, it is 20%. So right on that average there. From a supplement plan perspective, we talked about that average cost. There are lots of opportunities to find discounts. So there are discounts if you have somebody who lives in your household and if they are on the same insurance company as the plan that you pick. There are discounts that are available for you. There are also discounts if you're wearing like a smartwatch or a smart tracker that you can sync with the insurance company to show that you're active and exercising. Some plans have discounts for that. There are discounts available if you pay all of your premiums in a year upfront annually rather than monthly. So you combine all of these discounts and there are ways to get that well below the national average of that $150 mark. And then finally, there are a couple of plans that have gym memberships available to you if that's what you're looking for in your supplement plan. Now, the last point that is absolutely awesome with Oregon, where you're doing a good job protecting Medicare beneficiaries, relates to those who get Medicare before 65. That means you either are disabled, you have ESRD or kidney failure, or you have ALS or Lou Gehrig's disease. For those in most of the country, you do not have protections, and to get on a supplement plan is either impossible or incredibly expensive, and you're kind of confined to something like Plan A only or Plan B only, and it's $500 to $1,200 a month before you're 65 to get a supplement plan. So it's very hard for those pre-65 in certain instances to get covered by a supplement plan, and they're left with choosing either original Medicare only, or they are getting an Advantage plan, where they're trying to coordinate if they do have a job with their employer-sponsored plan. But here in Oregon, the rates are good and they protect those who are pre-65 and eligible for Medicare. The premiums for pre-65 plans cannot exceed the premiums of those who are 65. So a great rule. Again, Oregon, when you're looking at a model of what to do in terms of protecting Medicare beneficiaries with all of these rules we've talked about, Oregon's doing a very good job. If you do want to look into these options, you live in Oregon, I do have partners who are licensed and familiar with the state of Oregon. It will never cost you anything to reach out for help. If you decide to use us for Medicare, it still never costs you anything. So please don't hesitate to reach out. My email is in the description of this video. I've got a couple of more days to enjoy here in Oregon and see the state, and then we're headed to California. So thank you for spending time in this video, and we will see you in the next state.